Hello and welcome to a new episode of Entheogenic Renaissance. What if I told you that AI is pushing alcohol consumption and algorithms are taking over? There's a global conspiracy of corporations, they want you to drink alcohol. There's a cure, entheogens. Want to learn more? Watch this episode, don't forget to like, share and subscribe, let's roll! In this episode I will be talking to you about psychedelics. You've heard it right. I mean, pretty much same as usual. Yeah, let me just put that timer on so that I at least know how long I've been talking for. Okay, so today the topic that I will be covering is substance or particularly alcohol use disorder. And this is something that is widely covered, probably would be the word. Yeah, so my dog found a fucking elk and she's now killing it. I hope she won't disturb you, but anyway. Yeah, I've upgraded my setup here and things should be slightly better, hopefully, but we'll see. Let me know, put that in the comments, I want to hear your opinions. So why all of a sudden a alcohol use disorder and why am I talking about it? There was a person in my Telegram chat who responded and asked to record an episode, and there am I recording. So thank you for the topic because it is extremely relevant topic for myself as well. I will tell you why in just a minute. But beforehand, what I'm going to talk to you about today. What is alcohol use disorder? How big is the problem really? And are there ways to treat it? Yeah, there are, and of course the emerging entheogenic related or entheogenic-assisted therapy is the key here, but of course there are other options that sometimes don't work that effectively. What else? Yeah, we'll talk about skeptics, we'll talk about Alcoholics Anonymous. You've heard of that organization, right? They are helping people, but probably something that you didn't know is the co-founder Bill, what was his surname? Anyway, co-founder of Alcoholics Anonymous, Bill, I want to say white, but yeah, it's just some white dude. Anyway, so he said goodbye to alcohol because he had a psychedelic experience, although not technically like psychedelic substance. It was belladonna in New York in 1934. Anyway, yeah, let's go back to what I originally studied. So recently I've attended a webinar by actually, it was hosted by Open Foundation, but the doctor was called Ryan Zafar. I hope to pronounce it correctly, and I'll share the notes, and if necessary, put it in the comments, I'll get back to you. The webinar was amazing, and the dude was actually talking about the mechanisms of treating substance use disorder and general disorders like gambling, for instance, but the main focus was on alcohol. So before we dig into, we need to understand that this is really a big problem. So alcohol, if you take all the drugs in the world, the most dangerous out of them all is alcohol. You've heard me right. Alcohol is fucking more dangerous than opioids. Moreover, there's data from, what was it, 2010 by Professor David Nutt and the crew, let's put it this way, published in Lancet in The Economist, and they did an analysis of all the drugs and the substances, and the most harmful of them all was alcohol. Second was heroin, third was a methamphetamine, then tobacco, and then all the way down to psilocybin mushrooms, which are extremely safe, but you can fuck up your own psyche and eventually die if you're not careful enough, because people do stupid shit. Don't forget to find a sitter, first of all, if you consume, but neither am I endorsing nor condoning the use of psychedelics for recreational goals. There are countries where it is decriminalized and even legalized. In the EU you can go to Portugal or in Netherlands and some other countries, but I'm not gonna head that way. But if you want to, put it in the comments. So going back to the substance use disorders, talking about the substances, worldwide roughly 219 million people ever consumed weed or consume it from time to time, and 60 million people use opioids or some substances that are related to opioids, because opioids quite a big variety of drugs, and I've recently started to read a book, what was it, Drug Use for Grown-Ups, pretty interesting. The author is a doctor and he's been using heroin for 6 years, and it's really interesting to learn from a person who has been conducting research on drug use and himself using heroin, but he's doing fine, and surprisingly enough, heroin is not that bad as alcohol, right? Yeah, that's the topic we're talking about today. So I wanted to share some of my personal stories in the background and the reasons I have my own, I don't know, problems with alcohol, but I guess I do. I can't consider myself a recovering alcoholic pretty much. I haven't had an alcohol drink since November 2023. Today is April, beginning of April 2024. It's not that, you know, I went through a 12-step program. I used entheogens to help myself to get rid of the need and the cravings for alcohol. I haven't felt cravings since, and I don't feel the urge and need to drink alcohol, which is great. But I guess time will show whether or not this strategy is effective. But my father died of alcoholism, my grandfather died of alcoholism, but if you look at the data, there is no such cause as alcoholism as like a reason of death, okay? So people typically don't, you know, drink that much that they die. Rather, they die from other aspects like heart failure, kidney failure, like stroke or something like that. But the reason I say is that alcohol put them to the grave is that they've been drinking like motherfuckers, like, I don't know, like 2 together especially, and they died 6 months between them. So my father died first when I was like 17 years old, and he's been drinking since I was 12, and haven't seen him much. It was like just a very tough person to see when he was drunk. But yeah, that's not the story. It's not a psychological intervention here. I'm not like sharing too much, I hope. But the reason I wanted to touch that topic is that I know it is really very sensitive for me and very personal. That's why I am talking about it in the first place. And I know for sure that alcohol can cause a lot of fucking harm. So there's no such thing as safe dose of alcohol. Even one drink affects your body, but I'm not gonna preach if you consume alcohol, it's up to you, it's your decision, you're an adult, do whatever the fuck you want. I'm just talking about the facts here, and if you don't trust any of my facts, I do encourage you to double check whatever I say. If you find any inconsistencies, put it in the comments and let's discuss facts rather than opinions, all right? Okay, what else? I've been invited to a podcast recently. It's an interesting experience. Yeah, I will share after that happens. So, since middle of 20th century, entheogenic substances have been used and studied to treat alcohol use disorder. There's been multiple case studies, and actually, yeah, just looking at the screenshots that I've taken from that webinar. So, there's quantitative data since mid of 20th century of, you know, 325 people sample versus 210 control group, and, you know, which clearly shows that LSD is indeed very effective in treating alcohol use disorder. There are other studies from Soviet times, I mentioned some of them before, done by Dr. Kropitsky, and unfortunately I don't remember the rest. Anyway, in the end of 80s in Soviet Union, they've treated alcohol use disorder with the help of ketamine. If only I knew that psychedelics were able to do that, or entheogens, as I prefer to call them, I would have advised to my father or my grandfather to use them, because, you know, they can heal, and there's hard data showing that indeed this is something that can be used to treat people from that disorder. Let's put it this way. What do you typically call a disorder? Something that, you know, is affecting your life. When you've lost your job, you don't want to do anything, you just drink. I guess you have a disorder. If you're drinking every day, I guess you have a disorder. But it's up to you to decide whether or not it is time to do an intervention. So if you compare the, you know, the data from the studies from mid-20th century and the ones that are being doing right now, you can clearly see that there is effect. So people even stop drinking alcohol after a single dose of psilocybin. This is like insane. And this is of course like what's so-called heroic dose of psilocybin, which gives this feeling and sensation of ego death, oneness with the entire universe, and, you know, that so-called mystical experience. And in the long run, sustainably, it helps people avoid using alcohol further on. Let's quickly dive into the therapy. So the therapeutic aspect of treatment is very nuanced and depending on the substance that you use. And of course, if you compare with placebo, entheogen substances are way more effective, like significantly more effective. But placebo works, which is nice, doesn't it? Anyway, so the therapeutic approach is different. So sometimes it is more like an intervention. So for instance, in the study in the Soviet Union times, what they did is that when the person was dissociated from reality, basically high on ketamine, they brought like a piece of cotton with like either pure spirit or vodka to their nose, so that they have this very distinct association with the disgust of the either smell or taste, or everything's related to it. And people of course realize that they're poisoning themselves, they're causing suffering to their family, to their loved ones, and it's not working for them. So this is the reason they probably need to stop drinking alcohol this much. So this is Sherry. Meet her. She's a family member brought from a Moscow shelter all the way to Europe. She's got a EU passport, unlike me or my wife. We were thinking on maybe marrying her so that we also get a citizenship of EU. Good dog, good dog. Yeah, anyway, who would have known, right? Born in the street that you'd be a citizen of a European Union. Anyway, she's gonna stay here for a while, I guess. So what are the effects of alcohol in society? So it causes multiple health issues for people. As said, like obesity, one of them, and one of the easiest ways to lose weight is to stop drinking alcohol, surprisingly enough. And this is something that is being said by the neuroscientists and the doctors out there, because this is something that works, in case you're interested. Otherwise, digestive system, heart failure, kidneys, and other organs. So better to avoid alcohol, but of course it causes other problems with families. So one topic that I wanted to touch is about the algorithms, right? Doug, what do you know about AI? You don't, okay. Right, so I've been using ChatGPT for quite a while for various reasons, and one of them was to find me nice recipes of some delicious vegetarian dishes that I've been eating recently with my wife. And whenever that creature, I don't know how you call it, anyway, that entity or artificial intelligence, like I guess originally, gave me an offer to cook something specific, that motherfucker offered me a glass of wine here and there. So algorithms are fucking pushing the alcohol agenda. Yeah, sorry dog. They are suggesting right away to a person who may be not drinking or suffering from substance use disorder to drink a glass of wine. I mean, imagine that. And of course, there are people who are, I don't know, either coming from France or Italy or Spain would say, nothing special. But in the majority of cases, it is quite hard for the body, especially when we're talking about nations or, I guess, like humans that don't have this ferment in their body, which is causing the alcohol to dissolve, and whenever they drink like even a small amount, they're like fucked, they're completely drunk and they cannot operate as a human being. Why am I talking about all this? Effects on society, I guess I spoke about this a lot, so not enough, although, so, sorry, it's just too much hair. That dog is amazing. I mean, absolutely, I love this dog. I mean, she behaves really nice. We've trained her, and that dog was probably one of the few ever on antidepressants. Yeah, that's right, you heard me. So she was born on the street. I don't know why, but I'm just gonna share it. So we took her from shelter, and for the first half a year, she didn't want to go outside to even shit or pee. She did it, within our apartment. And at some point in time, we were even considering to, take her back. But yeah, well, luckily we persevered. We've hired a kinologist and he helped us to train her, but then again we went to the vet, and the vet advised to put her on meds. So she was on some antidepressants for half a year, and yeah, well, now she's definitely much better. I don't know why. Yeah, the reason I talk about is that she's amazing, but she sheds like crazy. So if you know what to do, just tell me. I guess I'm too broke to put her to like a service where they clean our eyes every day. If you want to, just throw some money in there, donate. Just kidding. I don't even... Yeah, maybe I do. Anyway, let's see what happens with this podcast over time, and maybe eventually she'll get some extra cash for spa procedures. Who knows? Anyway, going back to the alcohol. Yeah, so typically whenever a person is indeed suffering from alcohol use disorder, what they can do: go to the doctor, find a professional who could help them. What they can do also by themselves, if they have a stable psyche, if it is legal in the country they're located, if they're taking precautions, if they're not suffering from schizophrenia, bipolar disease, or their first bloodline relatives, and if they don't have a prior history of psychosis, if they're not on SSRIs, what they can do is, I guess, apply entheogens and sitter, naturally, who could help them navigate in the psychedelic experience, let's put it this way, to rewire own brain to get rid of the craving for alcohol. And this is said something that I did, because basically I've been consuming entheogens and telling to myself, like, you know, literally, I don't want to drink that, and kept on reminding myself of the cases when I've had a drink and it was like Friday, you know, nice night out, you're having fun with your friends, and then next day is fucking wasted because you're just so hungover that you're just suffering and trying to not die pretty much. But then you sit and think, like, why did I do this? Like, 2 hours of fun, like 3 at max, like 4, I don't know, but you know, for what? For just losing an entire day and destroying your body? But I've caused a lot of damage to myself. Unfortunately, I wasn't that smart enough, and there were other reasons that I wasn't able to deal with. I guess I wasn't addressing it in the first place. But anyway, if you do experience that type of issue, and you know, you got stable psyche, you want to get rid of alcohol use disorder, put it in the comments. I'll try to bring you in touch with people who practice therapy, because I'm not doing it. I'm studying for psychedelic-assisted coaching. That's totally different. I'm not conducting any therapy here, but I'm growing my network, my mycelium as they call it nowadays, and I build new connections with fellow psychonauts. I just recently, earlier today, had a call with a person from Poland and had a lunch with a person from Prague, or yeah, well, Czech Republic, and I'm not sure about Prague, particularly he's studying neuroscience in Netherlands. And, you know, amazing people. Some of them are clinicians, some of them psychologists, psychiatrists. As said, I will be participating in an ICPR, International Conference of Psychedelic Research, in June 2024 in Harlem. And I definitely advise you to go there and become part of the open community, of open foundation community, of fellow psychonauts and, I don't know, professionals rather. But anyway, what I wanted to say here is that I guess alcohol use disorder, I got too much hair now. Alcohol use disorder is a big problem for both humans, governments, economies, and families. If you're suffering, there are ways to deal with it, either through microdosing or macrodosing protocols, but those would be different depending on the circumstances that you're in. And don't forget to remember about safety measures. I will talk a lot about it, because even though psychedelics or entheogens are extremely safe, they're not 100% safe, okay? So indeed, one of the reasons, for example, why in Netherlands psilocybin mushrooms are prohibited but psilocybin truffles are not, is that one French student went to Amsterdam, went to a smart shop, bought mushrooms, magic mushrooms, got high, went to the bridge, jumped from it and died. I mean, that motherfucker didn't have a sitter. That's why he ended that way. So better remember, setting, preparation, sitter, and the rest was given in my video on how to avoid bad trip. Watch that one, and if you have any questions, put them in the comments. Otherwise, don't forget to like, share, subscribe, spread the knowledge about the therapeutic potential of entheogens further and further and further. And if you're in EU, check out the initiative called Parea, Parea.eu/EU24. So this initiative is about bringing psychedelics or introducing psychedelics in the medical system of EU. And if you are a resident or probably a citizen of EU, you can vote. Therefore, you can go to your local politicians and endorse them and tell them, go and change the medical system of EU, because people are suffering from mental illnesses, depression, PTSD, substance use disorder, alcohol use disorder, palliative care, like cancer patients who are about to die experiencing near-death anxiety, that can be treated with help of entheogens. So go vote and tell your politicians to, change and implement it in the medical system. I have no interest in it except for the access for people who are truly suffering for various reasons. Thank you for watching, and until next time.